Hello. Hello. Assalamualaikum. Can you hear me?
And being a part of our event. Without further ado, let's begin our program with a welcome address by Mrs. Aisha Sultana Sahiba, who is a research scholar at Usmania University and the editor of Aura e-Magazine. She is an ardent writer as well as someone who has contributed articles and leading newspapers. I now invite Aisha Sahiba to give the welcome address.
In the name of Almighty, the most gracious and merciful. Assalamu alaikum wa rahmatullahi wa barakatuhu. May peace and mercy be upon you all. Good evening, ladies and gentlemen. It is indeed a pleasure and honor to welcome you all on this occasion. We have very well-known and prominent personalities in our online program today. They need no introduction, still the formality demands it. Firstly, I would like to heartily welcome Dr. Sylvia Karpagam, public health doctor, researcher, and writer who would be launching our e-magazine Aura this evening. I would also like to welcome our other guest, keynote speaker of today's online program, Dr. Ghazala Jamil, author, translator, and assistant professor at the Center for Study of Law and Governance, Jawaharlal Nehru University, New Delhi. I also welcome our honorable guest, President, Jamaat-e-Islami Hind, Syed Sadatullah Hussaini Saab, renowned scholar and author who will be presiding over this program. I also heartily welcome all the panelists who are going to participate in the panel discussion on the politics of health and gender, followed by the launch of our e-magazine. I welcome Dr. Shahnaz Muttu, General Secretary of Women's Manifesto and Social Worker, Dr. Sylvia Karpagam, and Hamida Rashid Sahiba, Mental Health Counselor, founder of With You, India. I take this opportunity to once again heartily invite all the guests and viewers of this online program on behalf of Team Aura. Dear friends, As you all know, that the first issue of the e-Magazine is being launched today. Aura is an English language monthly women's e-magazine published from New Delhi. The magazine attempts to engage with women's voices and debates while centering societal, political, economic, and personal experiences of women from different communities. Drawing upon a framework of gender justice and social justice, Aura is an attempt to challenge popular stereotypes and media representations about the lives, dreams, and hopes of women from marginalized communities in India and beyond. Aura also plans to be a welcoming space for all media essays, long-form writing, flash fiction, journalistic pieces, graphic illustrations, design and artwork, interviews, and new and emerging experimental formats. The magazine is being launched in a testing time wherein the multiple concepts of political repression, the pandemic, and continuous forms of societal injustice. It becomes even more important to eke out spaces for women to representing themselves, their innermost self, and ambitions. The magazine draws its energies from this command in order to conceptualize a space for educating oneself and others, whether it be political education, religious, self-reflective, or in socio-economic matters. Aura envisions itself to be a space for community building. This means that it is open to voices that may contradict each other, may differ on many things, yet work together, carve out a niche for mutual learning. We hope Aura will become a home for many people who find that they have something to say but have not found a suitable space for their work so far. I hope, I feel, and I'm sure, inshallah, that Aura would be a reckoning in the future. Aura asks you all to support us in this endeavor and make it yours as well in a shared effort. Thanking you and welcoming you once again. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Ms. Aisha Sahiba, for such a warm welcoming address. Next, for the introductory address, I would like to invite our Chief Editor, Ms. Rahmatunnisa Sahiba, who is a dedicated social worker and the author of many articles and research papers in different languages. Rahmatunnisa Sahiba, the floor is yours. Rahmatunnisa Sahiba, you have to unmute yourself.
May the Almighty's peace and blessings be upon all of us. Assalamu alaikum wa rahmatullahi wa barakatuhu. Reading maketh a full man, conference a ready man, and writing an exact man. These are the words of Francis Bacon. But in the present scenario, the greatest difficulty is in choosing the best to read. Women's magazine means all those beauty tips and so on and so forth. But in order to revive the real feminine strength, we couldn't find many. Very rarely we find reading stuff for this to this end. Filling this gap is actually the objective of Aura as said by the editor Sahiba. Through the pages of Aura, we intend to make the suppressed voices heard loud and clear. At this happy occasion, I'm just recollecting the journey of Aura with the brainstorming sessions, interactions with experts, pros and cons debates. Alhamdulillah, finally, we are able to make it. We have a dedicated team, and I'm sure with the support of all of you, Team Aura will be moving forward from better to the best and eventually better than the best. Aura means the emotional, mental, and spiritual form of energy that feel around the body. It is the distinctive atmosphere or quality that seems to surround and be generated. We wish that the Aura e-Magazine will serve as an aura around our readers and will inspire and motivate and enlighten you. The first issue takes up the question of leadership and success and what this means to women. Leadership and success has been portrayed in a very superficial and tailor-made manner in our society. Aura questions this general concept and tries to analyze what it means to lead to challenge the set norms. Those norms set by a few. And are we supposed to follow them or think for ourselves? Team Aura is open to your valuable feedback. We ask your support in the form of reviews, comments, as and criticisms, as well as contributing in writing as per the policy of Aura. Thanking each and everyone who supported in this endeavor. If I start naming, I'm afraid that I will miss any one of them or many, that many people supported us, gave their valuable advices and pointed us towards the other side of the coin and what challenges we will be facing ahead. So all these may strengthen our team. And now it's my pleasure and my honor to submit Aura to you one and all. Aura will be yours. May God bless all of us. Thank you very much.
Thank you, Rahmatunnisa Sahiba, for giving us such an inspiring message through our introductory address. Some people dream of success, while others wake up and work hard at it, said Mark Zuckerberg. Our distinguished chief guest who will be launching Aura today is Dr. Sylvia Karpagam. Dr. Sylvia is a public health doctor and a researcher working on social determinants of health and part of the Right to Food and the Right to Health campaigns. She has worked closely with many organizations and groups working in diverse areas and has written on issues such as data collection, nutrition, children's health, medical policy, and so on. We are very happy to have you with us today, ma'am. I take immense pleasure in calling upon Dr. Sylvia to give the launching address. Dr. Sylvia, over to you.
Thank you so much. I'd like to start off by saying that the situation in the country is a cause of concern. There has been growing discrimination and growing targeting of certain communities. I think this was made particularly obvious during the COVID pandemic and during the lockdown. We saw how some people were able to manage through the lockdown, and some people really had to bear the brunt of it and face serious consequences. For instance, in the response to the pandemic itself, instead of following scientific methods and tested methods of how to respond to a pandemic, some sections of the government and also the media itself was communalizing the issue, and this had actual consequences on people's health, on people's psychological status, on their mental well-being, on their livelihood, on people's access to healthcare. And this kind of false news or fake news, I think, has been troubling all of us at different instances. And many of us see the consequences in day-to-day life of people. So a magazine like Aura, I think, is very timely. It is a need of the hour. And also, I think it's very courageous for this team to take up this kind of an endeavor at this time situation in the country. It's much needed, but it also requires a lot of courage. And I really appreciate the team for your dedication and for your creativity. So it's not only about putting out dry news, but you're trying to make it very readable to people and reach more people. And I really congratulate the team for this initiative. I request all the participants to share and use this resource and also contribute to it. And we have seen that in many instances, the corporates and the government voices get foregrounded and the media amplifies these things. Very often the real news and the lived reality of people, ordinary people, gets missed out. And this forum, I think, will offer that kind of space. And it's a very valuable space. And I congratulate the team for this.
Sophia, I think you have to unmute.
Yeah, sorry. The much awaited moment is here, and we are very excited to launch the e-magazine Aura. I now announce the launch of Aura, Reviving Feminine Strength. I request Dr. Sylvia to launch Aura.
I launched the Aura magazine.
Thank you so much, Dr. Sylvia, for being so supportive and helping us inspire. Thank you very much for also launching the magazine. We cannot change what we are not aware of, but surely once we are aware, we cannot help but change. In that regard, I'm pleased to introduce you all to our esteemed guest, Dr. Ghazala Jamil, Assistant Professor at the Center for the Study of Law and Governance, JNU, New Delhi, who has contributed to major issues of social change such as social development, social exclusion, destitution, and homelessness. She specializes in critical theory and post-colonial feminisms. We are proud to have you today with us, ma'am. I humbly request Dr. Ghazala Jamil to present the keynote address.
Thank you, Sophia. Thank you so much, Rahmat Appa, Aisha, and the entire editorial team of the Aura magazine. I extend my heartiest congratulations to all of you on occasion of the launch of Aura magazine. I wish my greetings also to Dr. Sylvia Karapagam and all the other esteemed guests in this Zoom meeting. And I know a launch of any publication is actually an occasion of happiness. I am a scholar of print cultures, and I'm very interested in media. But a launching of a women's magazine is doubly valuable. There are very few of these publications now in India, and later in my discussion with you, I'll share with you what is it that might set Aura magazine apart from all the rest of women's magazines available in India today. But more than just a women's magazine, a magazine that actually aims to, at least in the beginning, to bring about women's voices on various issues that impinge upon our public lives in India, that's something of great value to us today. Let me begin by reminding everybody who's watching us or our discussion today is that while on the one hand in India today we know, and there's a lot of discussion in the public sphere about the importance of privacy and the importance of limiting state regulation or government regulation only to certain areas of certain life, and we wish that on those arenas of life we may have our own autonomy. But I would also like to highlight another important component of democratic citizenship, which is often neglected, is the right of citizens to appear in public and to be able to represent themselves. If people are not able to represent themselves adequately, you can imagine it's quite straightforward actually. What would it mean for the health of a democracy? It is also not enough that people should just have their say. It is equally and extremely important that everybody's ideas are critically engaged with. It's not just enough that people have opinions and mere opinions about anything and everything can be freely articulated, but that issues of public importance, which include issues of public policy but are not limited only to public policy, those are also issues that everybody should have equal opportunity to express and to critically engage with. So if there are opinions about public policies or about public life, public matters that we do not agree with, then we may have the opportunity to also critically engage with ideas, whether we agree with them or we disagree with them. So public sphere is all about critical debates. But how are we to have critical debates? If it was a small community within which we are having public debates, then we can meet face to face, and those face to face meetings are important in which we can engage with each other's ideas. But in larger communities, such as whole countries, how are we to have these debates where we can actually represent ourselves? Can everybody participate in these debates equally? And it is in relation to this that production and control over media in which everybody has a chance to at least participate, even if not everybody can participate practically, but at least they have a chance to be represented there and they have a chance to participate. That's really important. So when we say, newspapers, magazines, etc., are media, what are they media of? They're media of public sphere, where people can actually voice their opinions about public issues and issues of general importance. And the rules of participating in this public sphere ought to be democratic, but they're not. We know that given the neoliberal society and highly, capitalist societies that we're living in, the control over big media has become one of the biggest problems that faces, democracy in India. So equality of access to media where you can actually freely express themselves is something of great importance. And we can see in India today that in face of big challenges, it is actually the small media and the digital media that is still, at least trying. How much they're successful, it remains to be seen. Of course, the story is still unfolding, but at least they're giving a good fight and they are making the big media run for their money. On the question of women in public sphere, it is also important that even when there are, alternative media in which voices that are not in power at the point of time can hope to have a certain kind of expression, women, given the structural, disadvantages, still do not get adequate space in even these spaces. And what to speak of Dalit and Muslim women, for example, who will, even amongst women, find that their voices are marginalized, that they are not given as much importance. There are also very few of them, and it's very important in public sphere for women to appear, to actually have the cultural capital, to have the network, to know each other, to build upon strengths of each other in which they can help each other find that space in public sphere and talk about issues that are of concern to them. If you look at the magazines that I mentioned in the beginning when I started to speak, women's magazine that are being published in India, what is it that you would see when you pick up any of these magazines? And you would see that what they're doing is to commodify and to package as a market good something that is sold, women's wish for equality and autonomy. So if women want to do that, then you pick up these magazines and they do make a lip service to talk about equality and autonomy, but they commodify it, they make it into a kind of product which is being sold to women themselves actually. So are women actually going to get any help from these magazines to push forward their agenda for autonomy, to have a say in public sphere about issues that are of concern to them? It doesn't seem likely. So if you look at any of the debates that are happening in public domain on issues that are of importance to women or larger society, we'll see that women's magazines being published in India today are completely untouched by that. They're not interested in those debates. And I don't have time to go into the details at this point. But if you look at most of these magazines, and it'll be clear to you that their imagination of women themselves is limited to as being consumers who can constitute only a certain kind of market to which certain kinds of products can be sold. And this is what they reduce women to. But interestingly enough, for me, trying to read and look into the history of publishing of women's magazines in India, appearance of a magazine such as Aura magazine is actually not an entirely new thing, but a recovery of a very illustrious history in India of publishing of women's magazine that actually had something to say of importance regarding women's education, regarding all the other public issues, issues related to rights of children, issues related to rights of their own communities that have become actually, even in the women's movement, unfashionable now. Just on the example of rights of children, for example, traditionally it has been the feminist movement across the world that has raised rights of children, because children, because of their developmental and cognitive limitations, they're not able to represent themselves. So are those issues not also women's issues? So the way they define women's issues is also extremely limited, and shows the crisis of care of capitalist societies, in which all one cares about is
can be sold.
Issues
And
related to
the way they
lifestyle,
define
and not
women's issues.
issues related to common good of the largest number of people in the society. So I think Aura magazine, we have great hopes from it, at least in the way it has framed what it intends to do. I certainly have great hopes from it, and I'm looking forward to not only reading essays and reports and analysis by women journalists, or on issues of concern to women, and but also other creative expressions and fiction, biography, to understand the reality, the everydayness of women in India and the challenges that are faced by them. I would like to end by making this last point about appearance of a magazine such as Aura. It is that, these days there is a proliferation of image in social media. It's the photograph or the moving image, which is everywhere, and we are consuming images all the time. We become, quintessential spectators. And while videos or images are extremely powerful medium of communication, in my opinion, and in opinion of many other writers, and of course a huge sort of community or public of readers, the written word is actually much more powerful and democratic, because reading requires and encourages contemplation. It is not as passive an activity as watching a video, and therefore I think, although I'm not saying that all the educational videos or such programming that is also part of the alternative and small digital media is useless. Certainly not. They have their own use, but I think what is really valuable, but also a huge gap of paucity of written word, which can be read by people, and then they can contemplate over it, they can analyze it, they can think about it deeply. That is something that only magazines can do. Even newspapers, because of the rush in which, and the topicality, and the frequency, probably can't do that good a job of it as magazines can do. So I think it's a really momentous occasion that Aura magazine is being launched, and I once again congratulate the entire team that has conceptualized it. I wish you all the best, and I wish Aura all the heights of publication and popularity amongst its reader. I hope it reaches the largest number of women across India. Thank you so much.
Thank you, Dr. Ghazala. Thank you so much for giving us so many diverse ideas to develop further, and also encouraging us and being so supportive. I now announce the launch of a historic Aura website, and you shall be seeing the website being live. That was the brief video of our Aura e-Magazine, which leaders become great not because of their power, but because of their ability to empower others. We are pleased to have among us one such great leader, Syed Sadatullah Hussaini Sahab. He is the Amir of Jamaat-e-Islami Hind. He is an electronics and telecommunication engineer by profession and an author of numerous books and articles by passion. I'm honored to call upon Syed Sadatullah Hussaini Sahab to deliver the presidential address.
Bismillahirrahmanirrahim. Nahmaduhu wa nusalli ala rasulihil kareem. Respected Chief Guest, Dr. Sylvia Karbagam, Dr. Ghazala Jamil, other honorable guests and panelists, Chief Editor of Aura, Mahatrama Rahmatun Nisa Sahiba, its editor, Mrs. Aisha Khammam, sub-editor, Mrs. Shaima, other members of editorial team, and ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. This is very happy occasion for all of us, and I'm feeling privileged and honored to be part of this launching ceremony of Women's Magazine Aura. I congratulate the sisters associated with this project. I pray Allah subhanahu wa ta'ala to make this project a huge success and enable it to achieve the desired objectives. The magazine is named Aura. I pray Allah to enable our magazine team to make it truly represent the beautiful aura of a woman as envisaged in Islamic traditions. This aura is characterized by the noble values of freedom, equality, modesty, dignity, elegance, and self-confidence in the feminine being. I'm very much thankful to our honorable guests who have graced this occasion. Dr. Sylvia, who is a great social worker and change leader, and she has enlightened us about the rising communal hatred in our society and how the great national calamities are being exploited for creating communal divide, and how this tendency is harmful for the whole society. I'm also thankful to Dr. Ghazala Jamil for her enlightening thoughts and insights about public sphere, rights to access to media, equal rights to access to media, marginalization of voices, and how women's magazines, instead of becoming voices of women and raising their voices, they are supporting or they are becoming tool of commodification of women. Today's woman is trapped between these two extremities. On the one side, there is traditional society where she is prey to extreme male chauvinism, where she is not able to express her individuality and utilize her talents for the development of society, where dowry deaths and dowry suicides are not unusual, and where domestic violence has become a norm, and where she is just a wife and mother and does not have any individual personality. The recent suicide of Aisha Khan in Gujarat has again generated a heated debate around the pathetic conditions of women. So this is a very dark side of our traditional society, and we desperately need a massive movement, both intellectual movement as well as a social drive to get rid of this menace. But unfortunately, the other side is equally gloomy. The modern, westernized, commercialized, and capitalist society has been more aggressive in the exploitation of women. This unisex society only cherishes and celebrates the masculine roles. Woman is forced to surrender her feminine personality and imitate her male counterpart to look modern and progressive. It has reduced the personality of a woman to her body, and it has become a norm, as Dr. Ghazala Jamil has rightly pointed, that it has become a norm that she is expected to become the object of lust and subject of consumption if she wants to become modern. So if traditional societies have subjugated her by snatching her individuality and her freedom and confined her to the dark prison of irrational and chauvinist traditions, then the modern societies have come out with another form of male chauvinism, where male lust and perceived superiority of masculine roles and persona, it makes the women a prisoner of fake freedom. Islam and Islamic traditions, traditional values have this strong inbuilt system to protect women from both kind of extremities. Here, women gets fullest respect and honor along with their feminine character. So I hope Aura will communicate the beautiful teachings as represented in our traditions. It will serve the purpose of both intra-community and inter-community communication. Outside community, many misunderstandings are related to the position of women in Islam. So we need inter-community communication. We need people from outside community to know that they should be able to comprehend and understand the Islam's perfectly balanced and highly practical system of gender justice. And we also need the intra-community communication that should bring in much needed reform in Muslim society and take it out from un-Islamic exploitative traditions and practices and ensure that Islam's paradigm of gender justice is truly and perfectly realized in real life, in real terms, in letter and in spirit. Women are part of society, and their concerns and their areas of interest need not be confined to the issues related to women and family. Or as Dr. Ghazala Jamil has rightly pointed, it should not be confined to just lifestyle related issues. The disruptive situation emerging in every part of the world need lot of creative energy so that we come out with great ideas for solving humanity's multifaceted problems. Our ladies, they also have a lot of creativity. The recently concluded campaign by Jamaat Islami Hind on strong society, strong family, this has demonstrated that huge chunk of the creative talents of our women and girls is still unexplored and underutilized. I hope Aura will be of immense help in developing and exploring these talents, and through this, ideas and creative energy of women will be channelized and their voices will become loud and clear and clearly audible to the whole humanity. So I once again congratulate everyone associated with this project and pray Allah subhanahu wa ta'ala for its success. Ameen. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallahu khair, Sadatullah Hussaini Sahab, for raising such important topics surrounding women during our times and sharing with us such beautiful words of your wisdom. Moving on, when issues pertaining to women and girls are given equal importance, communities and nations prosper. To discuss one such issue, we present to you the next highlight of today's event, the panel discussion on the politics of health and gender, which will be moderated by Mrs. Iman. Ms. Iman, over to you.
Thank you, Sophia. Am I audible?
Yeah, you're audible.
Okay, I think I have a problem with my connection. So if I'm not, just let me know, yeah?
Okay.
Okay, so to our panel discussion. The topic of our discussion today is on the politics of health and gender. And now more than ever, we have to discuss and evaluate the disparate patterns of healthcare that's afforded to women or not afforded, neglected, or even denied in both rural and urban spaces in India. So with our healthcare professionals and experts in its associated sectors, we hope to evaluate cultural and socio-political factors which impact women's healthcare with respect to accessibility, safety, equity, destigmatization, among others. So the panel discussion is such that we'll be having a set of discussion first, followed by 15 minutes of question answer session if time permits. So I request the audience to share their comments on our Facebook Live. We will be taking questions from there. So I would like to introduce our guests. As you've met Dr. Sylvia, who is a public health doctor and a researcher, and Dr. Sharnaz, who is, and Dr. Sharnaz, who is also a social worker and works with the healthcare of women, and Ms. Hamida, who is a therapist. So we will have a set of questions first. And my first question is to Dr. Sylvia. Dr. Sylvia, are you there?
Yes.
Okay. So kindly elaborate for us the various cultural and socio-political factors which affect women's healthcare in this country. Like what are they and what is something that's often neglected or we are not aware of? And it could be relevant just within, the healthcare professionals might be aware, but general public, what would you like to, enlighten us in that matter?
There are many factors that affect the quality and accessibility and equity in terms of healthcare. Even before the lockdown, there was very little focus on preventing disease and on addressing the social determinants of health. If you look at the social determinants, you have nutrition, you have livelihood, shelter, housing, education, and potable water, sanitation. All of these things are factors that affect one's health. So it is not only about having a curative healthcare. It's not like if you have a hospital, then your health is going to be ensured. You need a lot of factors that have been proved to affect the quality of health. And also, if you look at discrimination, these definitely affect the issues related to access to healthcare. For example, discrimination based on caste, on gender, on class, on occupation, on geographic location, on age. And I think this became very stark during the lockdown, where people from certain communities faced much more difficulty, not just in accessing healthcare, and by this I don't mean some complicated tertiary level healthcare, but even basic healthcare, people had a lot of issues in accessing this. And also, the if you look at the politics of it, it's a very narrow class and caste and gender group that is determining the policies of the country. And there is very little representation at the policy level of the real issues of people. There is a tendency for so-called policy making to be very closed door, and led by corporates and led by the government. So I think the farmers' protest is a good example of how policy making is actually not consultative. It's not keeping in with the real needs of the majority of people, and this is definitely affecting our access to healthcare. We also know that if we're looking at gender, we know that women access healthcare later, in a much more serious condition. And the further healthcare is from where women are located, the less likely they are able to access it. And this is not at all factored into any kind of program or policy. The kind of healthcare that we have even before the lockdown was a very centralized and commercial, corporatized kind of model. And women were definitely some of the group that was affected. And during lockdown, with the breakdown of public services, with the conversion of very good tertiary tertiary public hospitals being converted into COVID facilities, we saw the very serious impact this had on women, whether it was access to maternal health care or reproductive health services or contraceptives or other diseases like for non-communicable diseases, for tuberculosis, HIV, cancer care. So this adversely affected a lot of the poorer communities. And we are expecting actually the cases to rise of some of these conditions which were, being under control over the last few years. So I think, and if you look at the social schemes, whether it's a NREGA, that is a National Rural Employment Guarantee Act, whether it's the public distribution system, the Anganwadi system, the midday meals, the pensions, all of this shut down, and this has definitely affected people's access to basic income. Their livelihood has been affected, and we are expecting a serious nutrition crisis in the country. And we don't see a response from the government to match the scale of the problem that we are anticipating. Like we don't have data on what is going to be the rise in number of cases, what the government is going to do to actually address this crisis that we expect to be happening. And in fact, if you look at the budget of the government, it continues to be very oblivious to this problem. And in fact, the healthcare budget is more tending to push the budget towards the private sector. So I think this collusion between the government and the corporate sector is something that we all need to be concerned about, and we will be seeing the adverse consequences of this over time. So, I mean, that's just a brief of what I would like to say.
Thank you so much, Dr. Sylvia. That's in fact true, everything that you have stated. And as you mentioned, with COVID, things have just worsened. And is this the pattern that we have to be ready for? How do you expect, things moving forward? What are we supposed to expect or be prepared, at least, if the situation is indeed as dire as you mentioned?
Would you like me to speak, or you want the other speakers to?
No, you can go ahead. I'm going to the next speaker soon.
Okay, sorry, could you repeat the question?
No, I asked, like, given how you stated it, what would you recommend, or how would you, recommend we be prepared moving forward if the situations are indeed as dire as you mentioned now?
So I think the pandemic offers an important lesson for us in the sense we actually have come to realize how little we are prepared for a disaster. And I think in terms of healthcare itself, there's a lot of fragmentation of healthcare. There's a lot of centralization. So going forward, I think we need to demand for comprehensive health services closer to the people, that is accessible, and also most of the budget being invested in the public health facilities rather than these models like the public-private partnership or the health insurance models, which we know for sure are not accountable systems of healthcare. And also, I think we need to move away from this whole doctor-centric model, very urban doctor-centric model. We need to get more people from communities into the healthcare system, and we need to focus on all aspects of healthcare, whether it's prevention, curative care, or rehabilitation, and not just only on tertiary hospitals, which is what is the current situation. For instance, a doctor cannot function without a lab technician, or without a pharmacist, or without the Group D staff, or without the nursing care. But we saw during the lockdown that some of the frontline workers who are traditionally from the scheduled caste communities, they've had to work without even basic protective equipment, without even basic labor rights. Like, for instance, the people working in mortuaries, the people who are cleaning the streets, the people who are collecting garbage, the Group D workers in hospitals, the ambulance drivers, they had no protection. And I think we need to break down that whole doctor-centric, especially male doctor-centric model, and bring in a healthcare system that is much more compassionate and much more representative, and much more inclusive, non-discriminatory in all sense. Yeah, that's what I would like to say.
Thank you, Doctor. Now, based on whatever you have mentioned now, I would like to ask Dr. Sharnas to, expand on these social-political issues from your expertise as a social worker who works with the special police unit with regards to women. What are these issues, such as, we've read about neglect or illiteracy? So please elaborate more on that. You are actually muted.
Yeah, thank you, Iman. And I congratulate the whole team of Aura in this occasion. Actually, when we are talking about the socio-political or cultural issues regarding the health of women, मेन चीज जो सिल्विया मैम ने जो बोला सेम चीज means gender issues, cultural and caste issues, they plays a main role main role in the women's health issues. Means women actually experience a unique health care challenges. She has to address some specific physical and mental health needs due to hormonal and other changes, and she is going through in her life during menstruation, pregnancy, delivery, etc., and other so many other political socio-political factors. It's our existing system which gives least preference to women and which reflects in different dimensions of her life, including health. The sex ratio reveals that the male child preference of society. In most of the families, girl children neglects, and this reflects throughout her lifespan, which result female feticide, avoidance in childhood, stigma related to the menstruation in puberty and thereafter, the least preference to her health while she is changing her role from daughter to daughter-in-law, then importance to neonatal health than to mental health, maternal health after the delivery, then second preference to her health while she is playing the role of a caretaker in her later stages. There are so many issues. This varies from educational and socio-economic factors of the particular society where she is living. Now, if we look into the literacy and the women, which has a direct impact on her health, it prevents her to read the instructions on the medicines bottle and medical reports and restrict her knowledge on her own health or disease. Moreover, these women often bear the burden of caring for sick members of their families. It means that they will be less likely to know about the prevention, treatment, and support services. Low health literacy negatively affects a woman's health knowledge, preventive behavior, and ability to navigate the healthcare system. Then lack of knowledge about the dietary pattern during the pregnancy and the breastfeeding stage is also a main concern in most of the cases. Women are not aware about or they are ignorant about the maternal and reproductive health. Women are typically the least to eat in family. Thus, if there is not enough food, they have the ones to suffer some most resulting the medical conditions like anemia, malnutrition, etc. Means more than half of women suffer from anemia. Maternal malnutrition has been associated with an increased risk of maternal mortality and also childbirth defects. This majority of births takes place in home, especially in rural India, and out of these, most of not under the guidance or civil guidance of a trained medical practitioner. These women receive no prenatal care, and these factors result in higher maternal mortality rates in India. Then another concern, I think violence against women is also a health problem, but it is sadly not considered as one and it's ignored. If we go through the life of a survivor of violence, we can see that there are so many issues. They are not getting the emergency medical support, and even the system is not ready to provide MLC, which is essential for evidence in our adversarial system of judiciary. Sometimes the violence incidents cause her health issues, including diabetes, mental health issues, anemia, etc. I think during my PhD data collection, I remember one of the domestic violence survivor shared that the relationship problems caused anxiety in it. It makes a diabetic. Then husband did not take care of her after the health issues. This negligence caused further physical and psychological implications in the survivor. Means there are so many issues and socio-political issues we had to discuss considering the women health issues. That's all, Iman.
Thank you so much, Dr. Shahnaz. It's very enlightening, but also very sad to know that, so many aspects do affect the health of women, which are very easily neglected. So have these issues that you mentioned now, have they gotten worse? I'm assuming that they have gotten worse during the pandemic, or are we not seeing enough data to say it's gotten worse? Like, what is it based on your experience on the ground?
Yeah, definitely this worsened the situation. Means it's affected women more in a rigorous way. For example, I remember one of violence related one case. In that case, the particularly the one of the person, one of the one husband physically harassed the I think the one of our colleague was dealt with that case. She shared that the domestic violence survivor was physically harassed by her husband and broken her legs, but she didn't get any medical health, medical support from the hospital. Means she has no supporting mechanism to go to hospital, and husband also left her at that time, and her kids called her relatives. It takes time to reach them. Then no healthcare workers were not ready to provide services in her home. Even the palliative system was not available at that time. Means such type of condition also we faced in the COVID time. And another thing that as women we are giving more preference to the caring to others than ourselves. It means we are not caring ourselves, but we are giving more importance to the others' life. And now one of my I remember that one of my friends shared that the death of his relative due to COVID-19. Actually, how this death happened. Her husband was affected by the virus. Then she took care of him in the hospital without caring her age, diabetic, etc. Her only concern was that if any other person, children or any other relatives take care of him, he would not be fully satisfied. I am the only person to do it in a better way, and I'm not blaming the particular person she is taking care of her husband, but means a common general thinking of our women community is that we are the only person to take care of others, but we are not taking care of ourselves. This situation is also worsened the COVID-19 in the COVID-19 situation. We are more worried about the health condition of our children and other relatives. I'm not saying that we have not considered about them, but we have to consider ourselves also. Okay.
Yeah, that is very much true. Most of the way we as women interact in our societies is, like you said, we take care, but not really demand to be taken care of. Yeah. So Dr. Sylvia also mentioned, Dr. Shahnaz, you also mentioned about, the mental toll it takes. And for that, we go to Ms. Hamida. Can you elaborate in depth about how this mental toll is, the burden of carrying the duty of being the caretaker has affected women, and it is to be considered, I believe, a major part of healthcare, but unfortunately it is not, right?
Definitely. First of all, very congratulations for the launch of Aura. The video that we got to watch, it looked revolutionary. So very congratulations on that. So when we highlight the socio-political factors, when we talk about mental health along with that, mental health is, it is a state of well-being where an individual's ability to be aware, understand, and cope with the negatives or positives which may arise in everyday situations, of course, of our own, and not about other people. So before COVID, individuals whose well-being was not earlier affected, it definitely began to affect mentally during the COVID time, during the lockdown time. There was rise in domestic violence. There was an increase observed in suicide rates in women. Then it was before the lockdown. The daily stressors that women earlier had multiplied due to the management of households, family, elderly individuals in the house, their own work if they were working women, their children, the children's online classes, and the constant pressure of being laid off from the work if they were the ones who were working. So that all of those factors impacted women's mental health to a very great extent, considering the workload at home, because everybody's schedules change. The husband is at home working from home, children are studying from home, the woman, she herself is working from home, but everything has changed so much. Everything, the schedules, everything just changed. And as Dr. Sharna said, that the women had to shift roles from being a daughter to daughter-in-law to mother to the wife and to being an individual. She would wake up being an individual, and then she had to change her roles throughout the day for like 100 times in a day. So that completely affects an individual's mental health to a great extent. And as socially, women are always sort of told and sort of expected to be the submissive ones, be the ones to always take care of and not being taken care of. It increased, or it sort of multiplied to a very, very, very great level. Mm, Children were very bored at home. Their online classes were not satisfying them as much. They couldn't meet their friends, and they had their own behavioral reactions to that as well, which eventually had to be managed by, again, the mother and the wife of the house. Children were not sort of getting better in their studies in these days. Their social and physical and emotional development was definitely hindered by the pandemic. So when all of this is happening with everybody, the only person to understand and the only person to empathize, okay, my child is sick, my child is feeling bored, my child is angry because he's not getting out to play, because he's not getting to meet the friends, my husband is frustrated or is not feeling well or is not in the best of his state or anything, or my in-laws are not okay, I should cook for them nice so that they are happy, I should make the environment very good for everybody to be at least happy at home. That entire responsibility was completely into the woman or for the woman. So very well said by Dr. Sharnaz that we had to change a lot of roles during the day, 100 times in a day. um, when we talk about working women especially, their world had completely turned upside down. Earlier, what used to happen, we would wake up and we would do all the household chores and then go for work, and then for those 6 to 7 hours or 8 hours, it would be completely our time for work, and we would not have a mix up of everything going on. We would just have 3 to 4 calls from home, ye kahan rakha hai, where is this, I'm back from school, I'm back from work and stuff. But now it's completely shifted. So she has to attend the meeting, she also has to see ke cooker ki seeti bach gayi hai, I have to shut off the stuff, I have to also let my child sit in the online classes. So all of these things got gelled up all together a lot, and that definitely increased a lot of anxiety in women during these days. Research said that there was one organization where all the women employees requested the employer that, we don't want to work from home, keep the work from office open for us, we can't work from home. And also there was a lot of pressure for women to sort of excel in their work, because there was fear of being laid off also. There was fear that I'm going to be, thrown out from the work because I would not perform well. So there was pressure, there was a mix up of everything altogether. And at that point of time, we did not have adequate resources to provide everybody with their mental health support. The caller tunes that were provided by the government or by the central system would talk about the individual's physical health: take care of yourself, wear masks, if there is any symptom, call on so and so number. But there was no immediate steps taken for understanding or being aware of an individual's mental health. So I think one of the major problem that comes here is well-being is only considered as physical health and not mental health. So when well-being is actually a sum of physical and mental health altogether. So yes, during the COVID, during the pandemic that has hit all of us, more focus was not given on mental health, and it is going to have a lot of repercussions later on.
Thank you, Ms. Hamida. Like you said, these things were not taken care of then. So are there anything you would like to share with our audience, initiatives, movements, NGOs that they can reach out to, whether during the pandemic or even after it's over? Can you share some sources that our viewers might find useful?
Definitely. I mean, there are helplines. Personally speaking, there were trials to certain helplines which did not work during the COVID time. And maybe there was not a lot of focus given on that. So I could not really nationally mention any helpline or any sort of support that has been given by the NGOs. But there are sort of, organizations like the Sahas app. So the Sahas app was something that was specially built up for survivors of gender-based violence. And this app, it's a project. It's the gender security project, if I'm not wrong. So that sort of helped a lot of women to, they sort of rescued a lot of women out of their daily struggles in their homes with the rise in domestic violence rates as well. So this is one thing that I can talk about or I can think of right now. But nationally speaking, I think all the psychologists or all the counselors, they definitely came together to sort of provide a helpline where they offered free services to individuals. So the individuals had to come and, seek help. So there were instances where a group of psychologists from, I think, Delhi or Mumbai, they all got together and they sort of created a group where any client that has been suffering from so and so, reasons or due to COVID, whenever they were approached, they would give free services. But as NGOs or as the government sector, the organizations, there seemed less activity on that side. As I mentioned, that there was more focus given on the physical health rather than mental health. There could be a lot of NGOs, but nothing that came actively towards my eyes.
Okay, thank you. And I just want to remind our viewers, if you have any questions, please add them in the comment section. If we have time, we will definitely address them. Okay, now on to Dr. Sharnaz. The same question, like you mentioned a lot of, violence and people not being educated on how to take care of their children, of themselves. So what are the existing initiatives, efforts or taken by the government or NGOs that anybody can access? Because even if they exist, I believe that there's a gap between being aware of these efforts existing. So please share like anything that would be useful for our audience in that regard. Okay, you're muted again.
Yeah, okay. If we look into the women's health in a general way, we can see that there are so many governmental programs and non-governmental programs also. For example, National Rural Health Mission (NRHM). This is a common program. It's and the family welfare programs have been created to address the maternal health care needs of the women. In this program, the ASHA workers under this project which monitor the health concerns of women in community level, even though they were not paid properly for their services. NRHM program, ASHA workers, the link of the ASHA workers and with ASHA workers with the community, women and the government machinery. It's a appreciable work. And the ICDS programs, Integrated Child Development Scheme, it's one of the central government scheme which cater the health needs of women. Main attraction of this central government scheme is that which implement different programs in different parts of the country based on the priority of the area. Some states effectively utilizes the scheme. In Kerala, in block level, adolescent counselors are appointed under this to address the mental health issues of the women. It's a very good initiative from the part of Kerala government. And there are so many other programs also to address the issues of women. For example, Poshan Abhiyan Yojana, which addresses the malnutrition. And other than that, the NGO level, non-governmental level, HIV/AIDS program, RCH programs, which these programs sometimes the NGOs are implementing in their own level with the CSR funding and other thing. Otherwise, the collaborative level with government machineries and non-governmental level machineries. There are so many other programs also. Then we specifically look into the COVID-19 perspective. We should understand that it was an emergency situation. Means no one was ready to address the issues faced by the COVID-19. Means this emergency situation. But I think so many good initiatives, means I am taking the positive side of this. So many good initiatives. For example, National Commission for Women, they provided, means they are saying that so many violence related issues are reported in National Commission for Women website because they provided their services to the common people through the WhatsApp. Then they shared their WhatsApp number, then email, we can register the things in their portal. And other thing that the IBAS IBAS means mental health related be different our national institutions. They also provided online services and at the same time mobile services also, mobile ambulance services. It was a positive side from the part of government. Anyway, they have so many other limitations, accessibility regarding the schemes and other things, and government also focus on the women's health means reproductive health. Means we are limiting the health of women to reproductive health. I think this is one of the limitation of our government schemes and other things. Yes, Iman.
Yeah, thank you for sharing a very positive light in this regard, because it's kind of gets very sad hearing all the negatives of it. Okay, so now my next question is to Dr. Sylvia. You had mentioned a few social determinants of health earlier, and how whether it is reflected or not in our policies. So I just want to ask about how these are the differences in rural and urban spaces. If at all there's some good done in urban spaces, are we seeing the same effect in rural areas? And if not, how do you suggest we tackle the difference?
Thanks, Iman. So like I mentioned, even before the lockdown, if you look at the health services, there was a tendency for health services to be located in urban areas and cities, more focused on corporate sector. In fact, even some of the health insurance schemes and the so-called public-private partnerships were a way of routing most of the resources into the private health facilities, which were mainly located in urban areas. And after lockdown, this became even worse. And people, for example, if we ask people not to travel and to, try and stay at home. But if the COVID testing facility is not available in rural areas and public transport is shut down, then how are people expected to access these facilities? We saw that, people for emergencies, they had to pay anywhere between 9,000 to 15,000 just to get vehicles to be able to travel to the city to get access to healthcare. And even within the cities, like a lot of the public facilities were converted into COVID facilities. So definitely we saw a lot of problems in terms of access, especially of the rural communities, not just for COVID care, but also for non-COVID related health conditions. We've heard of pregnant women who've had to go from one hospital to another, being denied care. If they're positive, they asked to get a positive test. If they're negative, they asked to get a negative test, in the absence of which they've not been admitted into the hospitals. And I think the pandemic itself, it was unexpected. This is not the first time that a pandemic has happened. And any system like healthcare system should prepare for a disaster. So if not COVID, there might be other disasters. There may be natural disasters. There may be man-made disasters. There may be chemical or biological kind of, or nuclear kind of disasters. And this idea that the healthcare system should be strengthened after the disaster has taken place, I think that is very problematic. And I think Kerala is probably the only state which, because of its commitment to healthcare and because of its investment, and also because of the way they've handled previous, epidemics like the Nipah virus, I think the system itself was much more prepared. The group of volunteers were trained, and the peripheral centers had supplies, and there was accessibility to at least essential healthcare. I think these are the important lessons that we have to learn. And uh, at a policy level, I think there has been a, so if you want to privatize healthcare, you can only do it by also parallelly breaking down the public health system. And I think that we've been seeing more at a policy level. For example, the primary health center, which used to be self-sufficient, in the sense people, for most of their conditions, they could go to a primary health center, which was equipped with a trained doctor and with all allied professionals like the nurses and the pharmacists and lab technicians, and equipped with medicines and basic lab testing facilities. That has been slowly converted into a referral center. So this idea of telemedicine, again, we saw during the pandemic and lockdown that telemedicine works only in certain situations. It works for urban people who have access to good internet, who have access to their reports and are able to have a conversation with the doctor. It works with them, but it is very difficult to have a telemedicine kind of interaction with people who live in urban deprived areas or in rural areas. And also this idea of the touch, a doctor's touch is very important, but telemedicine kind of dehumanizes this whole process and makes it very mechanical. But then that is being pushed as the solution to a pandemic. And in fact, if you look at the budget, they do talk a lot about telemedicine. But I think we need to really decentralize healthcare, make the rural areas more sufficient, self-sufficient, and the maximum they would have to travel is to a district, like to a district headquarter. The district hospitals have to be much more equipped. Budget and human resource investment. I think if we don't learn from this pandemic, then it would be a great tragedy. And we have many lessons to learn.
Thank you for elaborating on that, Dr. Sylvia. My next question is the same to Dr. Sharnas and Hamida. I think we'll go with Dr. Sharnas first on the same, like, how do you identify the differences between rural India and urban India? And what are the things that we can do to tackle the difference?
Hi, Iman. Actually, I also think that the Sylvia ma'am told about the accessibility of healthcare services in the rural people. It's very difficult for them to access the services. Means if we are not getting the services within, I think within 2 or 3 kilometers, while considering the socioeconomic condition of women will not approach the healthcare system. Means that is her condition. She will give least priority to her health. But in this aspect also, we can see that in urban area also, a very few economically higher class, educated families can access the proper healthcare system. It's not easy for those who are living in slum areas. For example, if a lady who has a small children and no one to take care of her children in the home, or a woman who is working for daily wage will not prefer private hospital due to financial constraints, and not in a premier healthcare institutions like AIMS or medical colleges, district hospitals, where they have to spend whole or at least half day for the consultation. Here their preference will be the nearest Mohalla clinic, PHCs, etc. Then the quality of services, we could imagine that. I think another difference in rural and urban is that the family structure in urban areas may be liberal comparing to rural areas, and which gives a freedom to women to assert her agencyship, which provides choice to access to healthcare system to urban women comparing to rural women. That's it.
Thank you, Dr. Sharnas. And Hamida, would you like to add to that?
I mean, of course, Dr. Sylvia and Dr. Sharnas said very well about the physical health, about how inaccessible physical health is in rural areas. When we talk about mental health is a subject where even in the urban area, even in the urban cities, mental health is still considered a taboo. Somebody going through depression, anxiety, stress, is feeling a little low is still a taboo in the urban cities. So when we talk about rural areas, the only thing mental health is being considered about is the mental health conditions. Somebody having schizophrenia, somebody having bipolar disorder, somebody having epilepsy. So those are the things that actually comes under the psychiatric or a mental health conditions. So these are the things which are only being aware about in the rural India. So the rural India people may have very less knowledge about what stress is, or what depression is, or what anxiety is, or all these stresses are. So for them, the only mental health is all about somebody who has a mental health condition. So even for these people to access mental health support during the lockdown or the pandemic, or since the past 1.5 year now, it has been very difficult. It's not reached also. Earlier, what used to happen that all these organizations, NGOs would go there once in a week or once in a month, and they would make those awareness sessions where they would talk about mental health and where they would make aware people about it. But during the lockdown, during the pandemic, what happened that they could not also go to those areas. So for them, there was no income of awareness and no outgoing of what's been going on with them as well. So there is a big gap, a very, very significant gap between accessibility of mental health in the rural areas. I mean, I don't think there is even one psychiatrist in a government hospital in rural areas every day. They do make visits once in a week or twice in a week, not more than that. They don't have an in-house psychiatrist or a psychologist. So while in urban areas, we did see a bit of, quite a lot of awareness coming in all of a sudden, a lot of suicides taking place, domestic violence in rates increase. So it made people to at least learn about mental health, to at least be aware about mental health. And in the urban cities, people actually began to take help, began to seek help. Of course, there's a lot of misinformation going around with regards to mental health, but the movement has begun with a very positive regard in the urban cities, but a lot of work needs to be done in the rural India.
Thank you, Hamida. That was very informative. I think Dr. Sylvia has something to add.
Yeah, hi. I think the points raised about mental health are very important. But I also wanted to say that a lot of mental health professionals, and I mean health professionals in general, they come with a lot of prejudices and a lot of stereotypical opinions about patients. And I think in some ways they're not trained to look at different communities. So they might in some ways add to the crisis because of their own, their own social, like class or caste or religious or gender location. So it's like a double problem. So even if, in spite of health issues or mental health issues, if you do finally also access a professional, there's very little chance that they will be sensitive or they will be, non-discriminatory. The kind of words they use, the kind of prejudices they have, I think that can aggravate mental health issues in many instances, and we've actually seen that happening. We see where communities are targeted by healthcare professionals and specifically by mental health professionals. So I thought that was a point I should add.
Yeah, that's definitely an issue that we have to address. Actually, my next question is relevant to that. No discussion would be complete without bringing the topic of social media and the role it plays, especially in perpetrating these prejudices which translate to action. So when professionals themselves come into a profession with certain biases, it definitely affects those seeking that care. So Dr. Sylvia, or I mean, the same question I have to ask of Dr. Sharnas and Hamida too. How has social media played a role in this entire healthcare issues? I'm guessing it's mostly negative, but if there are positive things, how can we, maximize its impact, and negative, how can we minimize it? So I think we can go with Dr. Sylvia first.
Yeah, thank you. Yes, I think social media is something we should all take very seriously. And like you said, mostly it has had a very negative role. On the one hand, it is there are social media handles which clearly trying to project the government and corporates in a good light. And there is a lot of handles on social media that actively promote hatred, they promote communalism, they spread false news, misinformation. For example, if you look at the thing about Tablighi Jamaat in the pandemic, any one who has some idea of public health will understand that how do you prevent a new virus from entering a country. Clearly you control it at the international points of entry. You have good quarantine systems, and I mean, I think Kerala for that matter handled it like reasonably well. They allowed people to come in, but they had very strict regulations, and they did not discriminate people or allow certain people privilege entry. And I think that is a model that should have been followed. But with clearly both media and the government, rather than trying to control the disease and respond to the crisis, they use the easy route of communalizing the whole thing. And this has actual serious impact on people. It affected their livelihood, it affected their mental health, it affected the access to health services. To in livelihood, we've heard people who've they couldn't sell their products, street vendors who couldn't sell because of they coming from specifically the Muslim community. And the social media that spread this kind of false news or misrepresented or actually harassed and targeted communities, there was no way they were held accountable. And in fact, in many instances, they were actually rewarded. But I think there was a counter, a very strong counter. And we've seen a lot of young people respond. We've seen students respond. We've seen people challenging the fake news and making complaints. We've had campaigns against hate speech. And we've had people actually filing complaints against media channels. I think this is a very positive thing. And more and more people should participate against this very systemic kind of hate campaigns that are being launched in the country. And I think that in that context, Aura, I think you play a very significant role because you build from the strengths of communities and of people. You foreground voices of people who are mostly not heard. So yeah, I think voices like this are really important to challenge this kind of hate, which I think it's not only like social media has real impact on people, it has impact on their lives, and it has to be taken seriously. And we have to use social media as a counter to this kind of hate narrative.
Yes, definitely. And that's what we hope to be, inshallah, with this very momentous start. We hope to do exactly that, using social media as a tool to counter all the hate that's there. And Dr. Sharnaz, with your expertise on dealing with women, how would you say social media or technology has impacted them? Both, was it positive, and what are the positives and negatives?
Yeah, Iman. In continuation with Sylvia ma'am's response to that particular question, I think means social media played a big role to make a stressful situation in the initial stages of COVID-19. But at the same time, it also played a big role to dissemination of information on healthcare system, which makes it easy to link up the system. And means as a networking, it's makes it easy for sharing the information and other thing. And in preventive level also, social media played an important role. For example, the measure to boost immunity to prevent COVID-19. But most of the times the fake news plays a negative role. We had to follow, we had to do a balanced approach to social media. In particularly the violence and other things of women health issues. I think that especially in the COVID time, means social media help to respond to the emergency period. For example, online counseling services and therapy, consultation, and I think Hamida also explained in her talk that means some group, social media groups of physicians, yeah, mental health professionals, is that give as a resource team to for the consultation and for other support to the common people. Means it's played a very good role in that time also. Means we have to do a balanced approach to social media. Otherwise, I think our print media was also depends upon the social media at that time. Means means most of the times journalists were not ready to go. They were restricted to go to field, and at that time social media was a resource for them also. And I also think that in advocacy level also, the social media played a big role. For example, in the COVID, in the first lockdown time, I think the photos shared by media, especially the migrant workers' photos, and the impact of that was was very it's beyond our imagination. I think it means international level also At the same time, the means people were ready to give some charity and other works for the based on the particular photos. I think it's okay.
Thank you, Dr. Sharnaz. And moving on to Hamida, I'm sure there's a lot to add with respect to how social media has burdened people pre and during the pandemic. So please share with us your insights on the same.
With regards to mental health, there were positives and negatives very equally. The positives being that all of the professionals, mental health professionals, went digital, they went online, they all had their social media profiles for their services, and it sort of made it very accessible. So, for somebody like me in Ahmedabad, it was very easy to, have access to somebody, to a therapist who's sitting in Delhi. So it made very easy for me to access mental health that way very well. So I think that's when, because during the COVID times, mental health also became a subject. It became, the light on it, was very eminent. Everybody actually gave equal attention to mental health at that point of time. It was also important for everybody to now show that we are here. So it became more accessible due to social media, due to the digital platforms. But at the same time, when we talk about the negatives, I think it also became a subject that a lot of misinformation about the subject, about the profession, about the kinds of, disorders or the kinds of issues with regards to mental health. There was a lot of misinformation that was being provided. So somebody who's posting about mental health, and that person has about, let's say, 50,000 50,000 followers, that person talking about mental health, there were a lot of chances for all those 50,000 followers, out of them at least 5 people, sort of approaching this person for mental health support. So the mental health advocates or the mental health enthusiasts or the mental health bloggers sort of became mental health professionals. And that was something that, worked as a negative. And of course, we are people who are in the process to sort of, clean every misinformation that's been given, to bust all the myths around it. So we are working on it.
Thank you, Ms. Hamida. That's definitely not something I would have seen as necessarily as a negative thing. A lot of people discussing mental health, but yes, you're right. I guess that a lot of people who are not professionals contributing it can be counterproductive. So we have 15 minutes for question answers, but we don't see any questions. So we'll just go to the conclusion. So having discussed all this, different aspects of it, negligence, illiteracy, violence, mental health, the burden on the mental health, all that, what are your insights as professionals in the field dealing with people on the ground? What are your insights moving forward? What are things you would recommend? As professionals, we take note of, and as people accessing healthcare systems, what are we supposed to be aware of? Usually these topics are discussed with terms of what the doctors are supposed to do, or we inform patients on what they are supposed to do. But a very comprehensive, a very brief, I could say, an advice, what would you recommend our audience? Yeah, I think we can start with Dr. Sylvia.
Yeah, hi. I think there are some lessons to be learned from the pandemic. One is that if you're rich and well off and living in urban areas, it doesn't necessarily mean that you're going to be healthier or that you're going to have access to better healthcare. We've seen how exploitative the private healthcare sector was, and people were paying like in lakhs for healthcare. So I think the understanding also should be that there are many things that affect how we respond to a disease. So, for example, with this COVID pandemic, if people had better housing, if people had better livelihood, if they had better incomes, if there's better public transport, and if there was easier access to healthcare, if there's better nutrition, then all these things play a role in reducing the impact of the pandemic. So we need to understand that many of us are related. It's not that the rich are insulated and the poor can, face life anyhow they want. I think as a community, we need to understand that our lives are interconnected, and we need to ensure that everybody have access to like basic social determinants of health. And I think the healthcare system really needs to introspect in terms of how are they treating patients? Like, does a paying patient have more value than a non-paying patient? Are we, as a system, discriminating people because of their gender? How do we treat people from certain occupations, from certain class groups, from certain caste groups, religious groups? And how is that preventing their access to healthcare and therefore contributing to the disease prevalence in the country as a whole? We're also seeing that there are a lot of gaps in terms of testing, in terms of drug access, in terms of um, uh, uh, like basic diagnostic facilities. So we need to really work on strengthening that. And people have been spending out of pocket. It is called a catastrophic health expenditure because it leads to people going into poverty because of healthcare. So I think as a community, we need, and as a society, we need to push for better policies. The policies have to be more representative, more inclusive, and more comprehensive. And we have to challenge this whole corporatization and centralization and privatization of healthcare. And definitely focus on prevention and on preparing for disasters more than large tertiary curative kind of hospitals.
Definitely. Thank you, Doctor. Is Dr. Sharna back? Yeah, I can't see her.
Yeah, Himan.
Okay, yeah. So would you like to add to that?
Yeah, means that she said, like, it means we have to give a holistic approach to the means healthcare of women. Means we should care about the food habits, maintain personal hygiene. Then we have to minimize the health risk and aware the facilities available. Then at the same time, improve a health literacy. Health literacy will help especially women to access the services and at the same time means to respond easily and healthy behavioral pattern also. At the same time, we have to make a conducive environment to women within the domestic space and give importance to her physical and psychological health concerns. Means we have to give importance both, especially post-op, the mental health after the delivery. Means we should give a massive level awareness to individuals and families also regarding the mental health after the means after delivery and before the delivery, and the hormonal changes during the adolescence period and pregnancy period. Means first thing, we have to give a health literacy to everyone, and based upon that we have to give a preventive level approach within the family, within the individual level, and within the professional level also, I think. Yeah, Iman.
Thank you so much, Dr. Sharnaz. Hamida, we would like to hear your thoughts on the same.
So basically, as Dr. Sylvia said very beautifully, that we need to keep pushing for the policies, especially the policies that are more inclusive. So I think when it comes to mental health, there has to be some central body which is, sort of accessing everything, sort of keeping a check on everything, because it's not always possible to have everybody doing the right thing. As Dr. Sylvia also mentioned, incidents about how mental health professionals may not be doing what they are expected to do. So somebody, some central body to keep a check on what exactly is happening there. Another thing to all the people viewing this, all the people there, that the pandemic may go, the pandemic may, leave only very little sides of it, but your mental health is going to be there. It's going to be a part of your well-being. So after the pandemic goes, don't stop taking care of it. Keep taking care of it. It's a part of you, and it is always going to be a part of you. So please take care of it. And I think we as professionals, we everybody who are aware, I think Sophia in the beginning when we began with this said a very beautiful thing. I think I just remember half of it maybe, that once we are aware, if we don't work on it or if we don't take an action on it, then there is something wrong that we are doing. So right now, whoever is watching this, whoever is listening, if you're getting aware of it, let's begin to work on it one step at a time. So we may be able to help one person at least.
Thank you, Ms. Hamida. That is very well put. And yes, definitely a reminder to all of us that our mental health is as important as our physical health. And right now we might be focusing on it because we're overburdened, but even when things get easier, we shouldn't forget it. Thank you so much for sharing that. So with this, we come to the end of our panel discussion. I would like to thank all our speakers for their very informative and insightful points that they mentioned. There's definitely a lot more to be done, but the more we raise awareness, that's again one step towards creating change. So thank you all so much. I would now I'll pass it back to Sophia.
Wow, that was one very interesting panel discussion. I thank all the panelists and the moderator for carrying out such informative and insightful discussion, I must say, on the much needed topic of our times. I hope we all have benefited from it. I hope we all go a long way in creating this society free of social evils and achieving many milestones of success ahead. तू शाहीन है परवाज है काम तेरा तेरे सामने आसमां और भी हैं. Coming towards the end of our today's event, I request Ms. Shaima to present the vote of thanks. Ms. Shaima, over to you.
Am I audible?
Yes.
Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to start with something one of our speakers today said, which is that it sounds very simple, but actually is something for us to ponder upon, which is that reading requires contemplation. And we may be talking about it in the context of a magazine, in the literal sense of reading. But I think that it is relevant for us, particularly since we have been talking about mental health, about the society at large, and about reading itself, that it also has several layers. And that also means that reading oneself, reading the society around us, and doing and working creatively in a way that challenges not just others, but also challenges ourselves. So keeping these things in mind, I think the reason we chose to have a program like this, rather than just to have, release a magazine and go on with it, was that there were two reasons for that. One, of course, is that we are also trying to challenge, as some other speakers said, the popular conception and the popular idea of what a women's magazine should be. But also, the reason we did this was also that because we understand that creative work is often portrayed as the output of an individual or of only the people who are bringing it out, such as a magazine or a book or a novel. But it is always and inherently a community effort, because the ideas that we have are also not just products of ourselves, but also the people we learn from. And it doesn't have to be books or academics, but also our parents, our communities, people who have challenged us, people who have criticized us as well. So keeping that in mind, I would like to begin by thanking the many speakers and dignitaries who came here today and spoke to us, spoke with us, and also, I think very importantly, I would like to thank them very particularly because they took a chance on a magazine that is not yet published, that is very new. And to do that, to commit to that and speak from a platform itself is a very touching and very thankful moment for those of us at Aura. I would like to thank Amir Jamaat Syed Sadullah Hussaini Sahab for his lecture here today. And then, of course, our chief guest, Dr. Sylvia Karpagam, Dr. Ghazala Jameel, Hamida Rashid, Dr. Sharnas Muttu, and also our moderators, Sufia and Iman, who handled the program very well. Our chief editor and the editor of the magazine, Rehmatun Saiba and Aisha Sultana Saiba, respectively. And very importantly, I think our readers, our reviewers, and our commenters have given us a lot of responses and a lot of early responses, early comments on the magazine, which made it possible to be brought to the shape that it is here today. The editorial board of Aura, which put in a lot of hard work and a lot of commitment, and have done so even today for the launch. Very importantly, the technical team and the design team, because under a lot of time pressure, under a lot of load of work, they produced not just a beautiful magazine, but also this program today. I think a shout out is necessary to our sister magazine Hadia, which also had its launch today, the Urdu magazine. And finally, I think I would just like to say that I hope that all of you join the magazine, join the program today, open and go through our website, auraback.in, and get back to us with comments and criticism and reviews, because it is a very nascent effort. There will be mistakes, there will be faults, but we hope that we can grow from that and grow from it together. That's all I would like to say. Thank you so much.
Thank you, Ms. Shaima. Inshallah, will be growing together in this venture. Praise be to the Almighty for making this event happen. I thank all our chief guests, the panelists, our Amira Jamaat, and all our dear viewers for making this event a success. May Aura be a true symbol of reviving feminine strength. Jazakallahu khair. Thank you all so much. May you all have a great night.